Hello everyone, welcome back to my channel. So in this session I will be dealing with the functional columns part 2. So before watching this session, please do watch part 1 so that you will have an idea how these functional columns are arranged in the neural tube. So in the last session we already mentioned about the different columns, how they are arranged and how you get the sulcus limitans, the dorsal lamina, ventral lamina, everything we have discussed in the last section. So now we are going to see how the cranial nerve nuclei are arranged according to these functional columns. So before that, we know there are 12 cranial nerve nuclei, and the first and second olfactory and optic cranial nerves are not coming in this scenario, because we know the cranial nerve nuclei are seated from third onwards from the midbrain. Okay, so the first and second, they are actually special, and they are having the nerves receptors outside which are carried to the special cortical regions. So from third onwards, you have the cranial nerve nuclei seated in the brainstem, and the nerves are emerging from these nuclei which are seated in the brainstem. Okay. So generally, I would like to say, if you remember the positioning of the cranial nerves in the brainstem, it will be easy for you to even localize lesions, and even it will help you to understand the nucleolar organization. So roughly we can say third and fourth from midbrain, the cranial nerve nuclei, 3 and 4, they are arranged in the midbrain, 5, 6, 7, 8 in the pons, and 9, 10, 11, 12 in the medulla. So this is roughly speaking. I am not saying these nuclei are confined to that region, some have extensions. But roughly speaking, we can say that third and fourth in the midbrain, 5, 6, 7 and 8 in the pons, and 9, 10, 11 and 12 in the medulla. Always remember, 1 and 2 are not coming in the functional columns of the brainstem. Okay. So that is one thing. And another important thing which I would like to say is the cranial nerve nucleus of fifth cranial nerve, that is a trigeminal, it is having an extension throughout the brainstem. That means if you take a section in the midbrain, if you take a section in the pons, or if you take a section in the medulla, you will get a bit of the nucleus of the trigeminal. So the trigeminal nucleus is extending throughout the brainstem. So that is again one more thing. Apart from the one which I have already mentioned, like 3, 4 in the midbrain, 5, 6, 7, 8 in the pons, 9, 10, 11, 12 in the medulla. Apart from that, fifth nucleus is seen throughout the brainstem. That also you have to remember. Now, next thing is, we know the cranial nerves, some are motor, some are sensory, purely sensory, and some are mixed. That means some are having the motor as well as sensory components. Now, another important factor which you should keep in mind before coming to the arrangement of the functional columns is that you can remember the cranial nerves morphologically like this. That means the derivatives from the cranial myotomes are supplied by cranial nerves 3, 4, 6 and 12. Okay, so the derivatives of the cranial myotomes, they are supplied by 3, 4, 6 and 12 cranial nerves. Now, the derivatives of the branchial arches, we know there are 6 branchial arches and the fifth one disappears, you know all these things. So, these structures derived from these branchial arches are supplied by 5, 7, 9, 10 and 11. Okay, so these cranial nerve nuclei will be seen in relation with the structures derived from the branchial arches. And the final one, they are the special senses. So the cranial nerves which are concerned with special sensations, you know, the olfactory, optic, then the vestibulocochlear nerve. So these are the nerves which are concerned with the special sensations. Okay, so that is 1, 2 and 8. So this is just roughly a morphological classification of the cranial nerves according to the region of its supply. If you keep this in mind, it will be easy for you when we discuss about the functional columns. Now, we will come to the functional columns one by one. So we will start with the medialmost column, and then we will go to the lateralmost column. So please see the previous part 1 of the functional columns to know how these columns are arranged. So this is the medialmost column, that is a general somatic efferent, and the lateralmost column is the special somatic efferent. So efferent and efferent columns. And one thing which I can say, so generally speaking, we know that there are 7 functional columns, but when we tabulate, we can see that the special visceral efferent and general visceral efferent, they are actually dealt as one single thing. Okay, so there is only one column for that, and remaining are having separate columns. So that also please keep in mind. And the next thing which you should know is you have to write midbrain, pons and medulla. Okay, so I have already mentioned that 3rd and 4th belongs to midbrain, 5, 6, 7, 8 in pons and 9, 10, 11, 12 in medulla. So when you write or when you mark the nuclear composition, you have to keep this in mind. That means if you just have a look at the midbrain, only the 3rd and 4th cranial nerve nuclei will be coming in this region. Whatever be the column, you will be getting 3rd and 4th. And of course, the 5th one, that is the trigeminal. The nucleus of the trigeminal is an exception for this because it is having a nuclear component throughout the brainstem. So wherever you take a section, midbrain, pons or medulla, you will have the trigeminal nucleus. So that is an exception. That is the reason why you have a component of trigeminal in the midbrain. Now if you take the pons, you can see that it is having 5, 6, 7 and 8. So you can see here 5, 6, 7 and 8. Okay, so 5, 6, 7 and 8 will be coming here, and there will be some exceptions like 9 will be having a component here. So there are some exceptions, but generally speaking 5, 6, 7 and 8 comes in line with the pons. And when you come to the medullary part, medulla will be having the last 4 cranial nerve nuclei. So that is 9, 10, 11 and 12. So in most of the columns, if you see, you will be seeing the 9, 10, 11 and 12, and again with some exceptions like the 5th nuclei will be having an extension to the medulla. Then you will be having a portion of the 8th nerve nucleus also in the medulla. So 8 will be having a portion. So 5, 6, 7 and 8 usually belongs to the pons. So some exceptions will be there, but as a general rule, if you remember this, it will be easy for you. Okay, so let's see one by one. The first one is general somatic efferent, that is the motor component to supply the muscles. So they are actually 3, 4, 6 and 12, and they are actually derived from the cranial myotomes. We have already mentioned it here, the morphological classification of the cranial nerves. So 3, 4, 6 and 12. We know 3, 4 and 6 are actually dealing with the movements of the eyeball, and 12th that is the hypoglossal nerve, which is dealing with the movements of the tongue. So that is what is coming under the general somatic efferent, motor components, motor nuclei. So 3 and 4, as we have already discussed, it will be coming in the midbrain. 6 will be coming in the pons and 12 in the medulla. Now the next column is special visceral efferent. Special visceral efferent means the nuclear component which are dealing with the derivatives of the branchial arches. Okay, so you have the cranial nerves, nuclei of the cranial nerves, 5th nerve, 7th nerve, 9, 10, 11th nerve. Okay, so we know the 5th nerve, the trigeminal nerve, it is actually supplying the first arch. Then 7th nerve is supplying the second arch. And 9, 10, 11, the position is a bit ambiguous, hence called the nucleus ambiguous. All the 3 nuclei, 9, 10 and 11 together known as nucleus ambiguous. And they will be supplying the 3rd, 4th and 6th arch derivatives. Okay. So when we see the special visceral efferent, how the special visceral efferent is seen between the general columns, I have already dealt in part 1. Please do watch that in order to get a clear idea about this. So special visceral efferent, that column will be supplying the derivatives of the pharyngeal arches. So we know the first arch we have the 5th nerve, second arch we have the 7th nerve, and 3rd, 4th and 6th will be supplied by 9, 10 and 11. Together you call it as nucleus ambiguous, and they will be seen in the medulla. So 5 and 7 in pons and 9, 10, 11 in the medulla. So that's about special visceral efferent. Now coming to the next column, that is general visceral efferent. General visceral efferent. So what is it dealing with? So when we think about general, visceral, efferent, they are actually giving off the parasympathetic information to the parasympathetic ganglia in the body. Okay, parasympathetic ganglia. So when we think about the parasympathetic ganglia in the body, we know that ciliary ganglia, you have already studied about the ciliary ganglia. Then you have studied about the submandibular ganglia. Then you have studied the pterygopalatine ganglia, then otic ganglia. So these are the main 4 ganglia which are seen in the head and neck region, isn't it? Ciliary, the submandibular ganglion, then the pterygopalatine ganglion, as well as the otic ganglion. And apart from that, you have the vagus nerve which is supplying the or giving off the parasympathetic information to the rest of the body. So how is it arranged? So the first one, the general, visceral, efferent column, the first one is the oculomotor nerve, the third nerve, olfactory, optic, oculomotor, the third nerve. The nucleus of the oculomotor nerve, the Edinger-Westphal nucleus, is actually coming under the general, visceral, efferent because it is giving rise to the fibers for the ciliary ganglion. Okay, so that is coming in the midbrain region. Now coming to the next one, the next component means you have the facial nerve with 2 different types of nuclei. That is, one is called the superior salivatory nucleus and the other one is called the lacrimatory nucleus. So these are the 2 nuclei of the facial nerve. So superior salivatory nucleus, the fibers which are going through the nervus intermedius and chordae tympani will be connected to the submandibular ganglion, and the lacrimatory nucleus that will be giving fibers to the pterygopalatine ganglion through the nervus intermedius and greater superficial petrosal nerve. So the connections of the ganglion, I have dealt 1 or 2 ganglia in my channel. Please do watch. The remaining I will be doing it soon. So if you know the connections of the ganglion, this part will be very easy for you. So the first and foremost thing is, when you think about general, visceral, efferent, think about the parasympathetic ganglia and the fibers going to the parasympathetic ganglia. That's it. So the oculomotor in the midbrain, Edinger-Westphal nucleus, that is the nucleus which is coming under this section, which is going to the ciliary ganglion. When you come to the pons, the facial nerve, it has got 2 nuclei belonging to this region, that is superior salivatory nucleus connected to the submandibular ganglion and the lacrimatory nucleus connected to the pterygopalatine ganglion. Coming to the 9th, the glossopharyngeal nerve. So what about the glossopharyngeal nerve? That is the inferior salivatory nucleus. So glossopharyngeal nerve, we usually discuss it in the medulla, but a very small portion of it because of its nearness to the function, you have the inferior salivatory nucleus lying in the pons. Okay, and that is actually connected to the otic ganglion. So otic ganglion, you have the inferior salivatory nucleus of glossopharyngeal, and that portion is lying in the pons. Okay, now coming to the 10th, the vagus, which is actually the main parasympathetic nerve, which is supplying a major portion. And that the fibers of the vagus nerve, the parasympathetic component of the vagus nerve, it is derived from the dorsal nucleus of vagus, which is seated in the medulla. So when you hear GVE, that is general, visceral, efferent, that is something to do with the parasympathetic ganglia. Now coming to the next column, I have already mentioned that there are 7 columns, and this column we have actually fused the 2 parts, that is special visceral efferent and general visceral efferent. Okay, so we have fused these 2 columns, and in this you have the nucleus of tractus solitarius. Okay, nucleus of tractus solitarius, which is nothing but a combination of 3 cranial nerve nuclei, that is 7, 9 and 10. 7, 9 and 10 cranial nerve nuclei together you call it as nucleus of tractus solitarius. And I would like to show the details of the nucleus of tractus solitarius here. Though I have mentioned it as a longitudinal thing, it is somewhat like a U. Okay, so that you have a cranial end and a caudal end. So this part you can call it as a cranial end, and this part you can call it as a caudal end. And the caudal end, the entire thing is forming a U, Why? Because the caudal end, the fibers are actually interlacing. Commissural fibers of the vagus nerve. So the last one is the vagus, isn't it? So the commissural fibers will be interlacing, and from either side you have these two columns fusing in the midline, and that is how you get the nucleus of Tractus solitarius in the form of a U. And how are the nuclear components arranged in the nucleus of Tractus solitarius? We have already mentioned that this is a combination of special visceral efferent and general visceral efferent. Okay. So the cranial portion is called the gustatory nucleus. The U, if you take this entire thing as a U, the upper portion, a major portion of the upper part is called the gustatory nucleus. And gustatory means the taste sensation is a special sensation. Hence you call special visceral efferent. Out of these two, special visceral efferent is the gustatory nucleus, which is seated in the upper part, and it has got all the three components 7, 9 and 10. And the caudal portion is actually the sensations carried from the remaining part of the GIT up to the right 2/3 of the transverse colon. And that is supplied by the vagus nerve mainly, isn't it? Starting from the pharynx. So that is called the general sensations, general visceral efferent. And that is having only 9 and 10, glossopharyngeal and vagus. 7th is not coming in this region. Okay. So the caudal portion is the general visceral efferent component, and it is having only 9 and 10 cranial nerve nuclei. Okay, so all together 7, 9 and 10 together you call it as nucleus of Tractus solitarius. So the upper part is special and the lower part is general. So that's about the this column, which is actually a fused column, and the fusion is because of the fusion of the lower fibers of the vagus. Now the next one is general somatic efferent. The general somatic efferent is dealt by one single cranial nerve, that is the trigeminal nerve. Okay, so the trigeminal nerve has got an extension throughout the brainstem. So the part which is extending into the midbrain, you call it as mesencephalic nucleus. So from the word itself, you know, mesencephalon. So mesencephalic nucleus, the part which is extending to the midbrain. The part which is seen in the pons, you call it as chief sensory nucleus, and the part which is extending into the medulla, you call it as spinal nucleus of trigeminal. So these nuclei will be dealing with the general sensations coming from the somatic part. That is, the mesencephalic nucleus will be dealing with the proprioception coming from the mandibular divisions of the trigeminal nerve. Then the chief sensory will be dealing with the touch sensations, and the spinal nucleus will be dealing with the pain and temperature sensations. So that is about the general somatic efferent column, and that is exclusively by the trigeminal nerve nucleus, which is spread throughout the brainstem in the form of mesencephalic, chief sensory and spinal. Now coming to the last column, which is the one which has got added towards the end of the functional columns, that is the special somatic efferent, and that is by the 8th nerve. Okay, so 8th nerve, vestibulocochlear nerve, has got two sets of nuclei as well, the vestibular nuclei and the cochlear nuclei. And from the diagram itself, we can see that this is shared between the pons and medulla. Though we say that 8 belongs to pons, a part of it is extending into the medulla as well. And when you talk about the vestibular nucleus, we can see that it is having 4 components like superior, inferior, lateral, medial. Okay, so that is how the vestibular nucleus is arranged. Superior, inferior, medial and lateral, diagonally opposite. Okay, so that is the vestibular nuclei, and you can see that it is arranged or shared between the pons and medulla. And the cochlear nuclei are arranged dorsal and ventral to the inferior cerebellar peduncle. So you have the dorsal cochlear nucleus and the ventral cochlear nucleus. Both are arranged dorsally and ventrally to the inferior cerebellar peduncle. So again, that also will be, a portion of it will be dorsal mainly coming in the pons and ventral coming in the medulla. So special somatic efferent will be dealing with the hearing and balancing. The balancing part by the vestibular nucleus and the hearing part by the cochlear nucleus. So if you know the cranial nerves, the region which is supplied by these cranial nerves, then arranging it according to the functional column is very easy. So before watching this session, please do watch part 1 so that you will have an idea how these columns are arranged. And thank you for watching. Please let me know whether you need some other topics, and actually your messages are really motivating for me to do more and more sessions. Thank you.